Dr. Gant brings a lot to the table. Has a degree in is a BS in chemistry, is an MD. He has PhDs in psychology and psychiatry, worked in those areas, and does a lot with genetics and brain health in a lot of areas. So, and I don't have his bio in front of me, but he's written some books. He's very knowledgeable, and I know him. I've known him because of my affiliation with National Integrated Health Associates. So he's going to jump in, and it's maybe a little jump around on his slideshow, but give us about 20, 30 minutes of brain health and what we should be doing. Is that correct, Dr. Gans? And then he has to go take care of his dog. Oh, who's waiting at home? He should have, but he's in Arlington. And
he already knows the Yeah, he's heard it many times.
And I wanted to, in the meantime, and they're serving food, which is good, give a shout out to our guitar player, our musical accompaniment during dinner, Mike Fearson over there. Mike is a great guy. He's like my brother. He is actually the #2 guitar instructor in the United States for the Guitar Centers. And he's my guitar instructor, and I love getting lessons from him. So anyway, and we have Natasha Klaus back on the camera there, producer, instructor at American GW, and a lot of I'm very happy to have her here with us. Thank you. So we'll get started with Dr. Gant's presentation and do a quick Q&A. Keep eating in the meantime if there's anything, and then we'll go from there. Thank you.
So I put together some slides and left it on my computer. And so I'll do the best I can with these backup slides here. Okay, everybody can hear me okay? It's kind of noisy out there. Okay. So the slide I have up here was the model that we were using 20 years ago, but it's still a very good model because it integrates many approaches to brain health. Since we have a 5R healing for the gut, I put together a 7R healing for the brain. So I'll just go through this real quick because I want to update you on the newer model. George Box, one of the most famous statisticians of the 20th century, said all models are wrong, but some are useful. So I found these models to be very useful so that I don't leave anything out as I personalize treatment for patients. And that's the whole point, a whole important thing about integrative medicine, to personalize treatment to the individual. Everybody's treatment is completely different. So, see here, is there a little pointer? And which one is the pointer? I'll try something, see what happens. All right. So in the 7 R's of brain healing, replenish basic brain nutrition. This is obvious. The old joke that if you want to lose 20 pounds of ugly fat, just cut off your head. And the interesting thing about that is the brain is mostly made of fat. The command and control center for everything else in the body, of course, at the most 5%, more like 3% of the body's weight, consuming 20 to 30% of the body's oxygen, blood flow, and nutrient at rest. So only the heart will supersede the brain in terms of its nutritional requirements. So brain nutrition, of course, is a topic that's very, very underrepresented in our healthcare system. But since the brain is made of fat, it's easy to understand what kind of fats we need. Essential fats, right? So because our diet for most of the year, for most Homo sapiens all the way back for the last million years, for most of the year was fish, seeds, and nuts. And we've lost the ability to make an omega-3 oil from fish, and some of the seeds too, and the omega-6 oils. So right away, I give every patient either flax if they're vegetarian or fish oil, and borage oil for the omega-6s. And then, of course, we diagnostically test patients to find out exactly which oils are you missing and why. And so I want to make sure the basic nutrition is plugged in, and what's called phospholipids. Because we don't eat liver anymore, and it quit liver in the last month. Here, we got somebody. All right, we got true believers here. All right. So you're getting phospholipids, lecithin, and lecithin has the 4 essential phospholipids that are used to make cell membranes, and very, very important, of course. So basic great nutrition, B vitamins, and essential fatty acids, important proteins, and so forth. So then, to make sure that nutrition gets to the brain, second R is to revive the gastrointestinal tract. Everybody's heard of the microbiome, right? The ecosystem that lives in our gut, which dictates so much of our health. And that was only coined 13 years ago. The term, it was non-existent in medicine. So a healthy microbiome is in so many ways related to brain health. Everything from detoxification to the delivery of nutrients and so forth. The third R is to reduce brain oxidative stress and inflammation. So oxidative stress can happen a couple different ways. Maybe Dr. Weiner could say a few things later about the importance of oxygen, but we're talking about 2 to 3% of the body's weight, consuming 20 to 30% of the body's oxygen. So the brain is going to really suffer when there is any interruption of oxygen, and that causes oxidative stress. But we can also have, we have to burn toxins, and we have to kill germs. So chronic infections and toxins are burned in the body, and that creates oxidative stress, and this can have a major influence on brain health. And it can injure the essential fatty acids too, which are very vulnerable to oxidative stress. The repair of neurons and brain cells, again, we're talking about essential fats primarily, but there are some other basic nutrients that go into brain health, and we do diagnostic testing to make sure that they're present. Remove neurotoxins. So I'll spend a little more time talking about that, since detoxification is 70% of what I do, either detoxifying chronic infections like Candida or Lyme, or detoxifying petrochemicals, heavy metals. We live at the edge of 200 years of an industrial revolution. The air, food, and water is heavily contaminated. So we do genetic testing, genomic testing on everybody to find out if those individuals that are especially vulnerable to toxins. Some people don't make enough glutathione genetically, so we know that person is going to be very vulnerable. Some people have peroxidase polymorphisms. They can't break down pesticides. So those people have to eat organic food. There's just no way around it, or they're going to suffer dramatically. So removing of neurotoxins, I'll spend a little more time on that shortly. And then restore the neurotransmitters. After all this is done, then we want to put back serotonin, the brain's natural Prozac, GABA, the brain's natural Valium, dopamine, the brain's natural amphetamines, enkephalins, the brain's natural endorphins, acetylcholine, the brain's natural nicotine. We want to put back these neurotransmitters that help us feel good and cope with life, but it's not going to work until we get the brain detoxified and get it basically fed. So this is a strategy that goes step by step. So restoring and other stress hormones, like cortisol is a stress hormone. We have these stress hormones to basically help us cope with stress. And we'll see in a minute, it isn't just psycho-emotional stress. It's allergic stress, toxic stress, all kinds of stressors that we have that are the reason that psychiatric disorders exist at all. Okay? And so I do a lot of mindfulness training with my patients, and I still do some psychotherapy from the old days, cognitive work. And once I get the brain healed, then I show a person how to, in various ways, how to deal with their irrational thinking, their disowned feelings, and to actually put themselves at a position of cause rather than effect of the universe around them. So that's the basic strategy, and this is what I was doing 10, 20 years ago. But it's still a very, very good model. And this is the roadmap, just stated in a different way, step-by-step process to eventually get to the point where R7 happens. So 2 phases. One phase is, well, 3 phases really. One phase is, for a lot of people, get off the psychotropic drugs. I mean, my goodness. We're 5% of the world's population consuming 50% of the world's pharmaceuticals and over 80% of the world's opioids. You've heard about the opioid epidemic? So in one of my books, I explained how we cure this 15 years ago, but nobody listens. We can regenerate opioids in a person's brain. There's 5 amino acids that do it. Come on, it's simple. And we do it intravenously. If we don't want to wait for the oral supplements to work, we just slam them in by intravenously, and the person stops craving drugs right away. And several rehabs around the country are using my protocols, and a lot of the outpatient treatment centers. So, all right, so I have to go to slide number 73. Are these numbered, I hope? Yeah, okay. So, I apologize for jumping around here. I got a good drum beat for the guitar.
You had half an hour to prepare, come on.
So here's just the restatement of that. Serotonin is the brain's natural Prozac. So people have heard of Prozac instead of serotonin, which it should be the other way around. This is the brain's relaxing. It gets its name from serenity. Dopamine is the brain's natural Ritalin and amphetamine. GABA is the brain's natural Xanax. Enkephalins, endorphins is the brain's natural heroin. Acetylcholine is the brain's natural nicotine. Oh, this is a good one. Endocannabinoids. And I get my pot patients and I say, look it up on Wikipedia. Look up endocannabinoids. And they're like, whoa, man, the brain makes its own pot, man. And it does. Now, the difference in restoring neurotransmitters the natural way is it can only take you from dysphoria to euthymia, which is normal, because there are all these control mechanisms built into the brain that if you do it naturally, you can only be normal. You can't go to euphoria with nutritional supplements the way drugs take it. So addicts have to get used to being normal and not being euphoric. They have to get comfortable just feeling upbeat, feeling good, expressive, but not euphorically expressive. See, that's a hard thing for anybody in recovery to get. Okay, so let's see. So this is the brain. Lecithin, I mentioned, is the brain's, has phosphatidylcholine in it, which repairs the brain, but choline is also the precursor for acetylcholine. The receptors in the brain for acetylcholine are called nicotinic receptors, named after nicotine. Nicotine fits into those receptors. When we replenish lecithin, cheap stuff, you can buy it, and vitamin B5 in high doses, which acetylates the choline into acetylcholine. when we replenish that, it's hard to smoke. And the cigarettes taste bad. So, of course, this kills 500,000 people in the U.S. pretty much. Tobacco. It's not heart disease. It's not cancer. It's tobacco, which causes the heart disease and the cancer. And 5 million people worldwide at least. So this is a big issue for me because we can simply smoke. I tell smokers, I want you to take these supplements twice a day, or a heavy smoker 3 times a day, and make my day, punk, like the Clint Eastwood line. Make my day. Try to smoke. Just try it. And so when I introduced this, when I was medical director at a large rehab in upstate New York, I would ask the chronic lung people and the heart disease people, do you want to stop smoking? And they'd say, what the hell, you're asking me to stop drinking. I'm not going to give up cigarettes. You're crazy. And so I'd slip the lecithin into their supplements, right? So 2 days later, they'd be allowed to smoke outside, and they'd be smoking. They go, God, these cigarettes taste like crap. What is the matter with them? The doc probably put the lecithin in your batch there and makes them taste really bad. Okay. Now, our culture is going to have to figure this out, that we can't go on consuming 50% of the world's pharmaceuticals as 5% of the world's population. See, the crony capitalism in Washington, the big business that drugs represent, we're just going to have to figure this out one of these days. Okay? It's unsustainable, and now the Center for Disease Control tells us life expectancies are going down now. 8 out of 10 markers of life expectancy are now going down, and we're on our way. I've expected it for a long time, because how can you go on with this unsustainable thing that we're doing? Right? Just covering up symptoms with chemicals. So, all right, let's see what I got. And this is our outcome study with average decrease in cigarette use for greater than 2 packs a day, 1 to 2 packs a day, less than 1 pack a day. Week 1, week 2, week 3. So it's pretty much documented and proven. All right, I want to go to slide 55 here. Whoops, am I going in the wrong direction? Yeah. Maybe I could hold it down and it will go fast on its own. Okay, so one of the R's was to detoxify, and that I mentioned, and there are some classes of important neurotoxins. One class is, of course, heavy metals. We do heavy metal testing of at least the serum and the red blood cells, but we'll do hair, stool, and urine also to make sure we're not missing heavy metals. And then there are energetic kinesiological techniques that are used at NIA to also pick up the heavy metals to make sure we don't miss them, because they are so dangerous. And if you have mercury fillings in your teeth, put in the computer University of Calgary and mercury, and look at the research on this, and look what happens to brain cells in the presence of mercury. So please get your mercury fillings out, and you want a safe dentist, not just a biological, you want safe biological dentistry, because safe means that you're protected from absorbing more mercury. It has a vapor pressure with the kinds of precautions that dentists like Dr. Weiner, Dr. McClure take at NIA. So another type of toxin is mycotoxin.
Can I interrupt real quick?
Yeah.
On the mercury, so if we get it out of our teeth, we're done, right? It's not in our body.
Yeah, of course. Yeah, well, there's a flow chart here. There's an input and there's an output. And then there's the body storage. So at least if we get the input side of the equation handled, then we accelerate the egress of heavy metals from the body too. And little by little, the body burden goes down. Yeah, good point. Yeah, it doesn't stop there. And Dr. McClure likes to use the term detoxification for life. Once you get in the swing of things, remember that we're living in air, food, and water. We got some major things to do about air, food, and water. If we love life, if we support life, if we respect life. Okay, mold toxins, mycotoxins. You live in the sinuses, chronic sinusitis. If anybody has chronic sinusitis, taking Zyrtec all the time, I mean year round, not talking about just seasonal, you have a fungal infection in your sinuses. And that can cause a lot of problems, including brain fog, short-term memory. A lot of people are losing their short-term memory. They think they got Alzheimer's or something. They don't. It's just mycotoxins. And the gut, of course, is another place that mold fungus lives. And so we do very careful stool cultures, we do blood work, we do urine tests. We go to great lengths to identify where the fungus is, and we blast it away. We don't put up with any of it. And so we have strategies that work in just about everybody. I can do them in my sleep now. They're so simple, but there are certain things that have to be done to make sure that the mold is eliminated. Another toxicity is brain allergies, food allergies, leaky gut, especially wheat allergies. Celiac or wheat allergy can cause schizophrenia, serious psychiatric disorders. Just one thing. So wheat, and especially, but we test 100 foods routinely, everybody. We have relatively inexpensive testing to do that. And we went to eliminate the allergic foods because some of them, or the digested fragments of them, are literally neurotoxic. Environmental toxins, of course, herbicides, pesticides, fungicides, you name it. And people, like I mentioned, genetically just can't break down certain toxins, so we triage out those people to make sure we know who they are. The gut, sinus, dental related toxins. Cavitations, root canals. If you have root canals, I probably should speak to this guy over here and at least find out if the root canals are infected. Eventually, I think they all get infected, but root canals can be very dangerous. Abscesses form in the bone, and people don't even know they have them, but they're breeding toxins. And we can see the results of those in some of the diagnostic testing because the tetanus germ is one of the germs that Clostridia likes to live in those areas. We're living in an endemic Lyme country, right? So we don't like neuro-Lyme. We don't like the brain to be affected, but the toxicity can be a factor, but we don't want Lyme getting in the nervous system. So homeopathics, herbals, and colloidal silver we use to stop Lyme, so it cannot get in the nervous system, and it works. That's first and foremost. I don't chase it with antibiotics unless it's already in the brain, because you can't cure Lyme anyway, so what does it matter? Why make people sick with antibiotics when so I put antibiotics at the very end of the treatment for Lyme. Okay, and psychotropic toxins, the #1 cause of death and disability in the world. Hands down, nothing that comes even close. Tobacco alone, 500,000 Americans, but cirrhosis is 100,000 people a year. Where does cirrhosis come from? Yeah. And now the opioid epidemic has superseded deaths from auto accidents. It's kind of hot here, or is it just me? Yeah, can they turn down the heat or something? So psychotropic toxins are a major cause of death and disability, and we've got a big problem, and we're legislating it ridiculously because people under the age of 21 are vastly more vulnerable to psychotropic toxins. A brain that's hardwired over the age of 20 or so is much, much less vulnerable to psychotropic toxins. So we need to stop individuals who are using psychotropic toxins while the brain is forming and while the last ramifications are being made, the last connections are being made in the brain. we need to get drugs out of the brains of our youth. And this permissive thing we have where, oh, wow, my kid just drinks a few 6-packs a week. I mean, this is crazy. And now they're saying he only does a little heroin once in a while. I mean, heroin has gotten so common now, he only shoots up once a week. That's what parents are telling me. His friends are shooting up 4 or 5 times a week. You know, I mean, it's like, it's insane, you know, what's going on. All right. Okay. So now I have to go to slide 29. All right, so the new model we use is about stress. Stress is not money, relationships, job. Stress is unconscious. Freud was right. The stressors, the bulk of the stressors we face are unconscious. Food allergies, allergic stress, immune stress, toxic stress, infectious stress, nutritional deficiency stress, and the stressors imposed by genetic vulnerability. So I wind up testing 800 different analytes on an average patient. I mean, it's crazy. You know, everybody knows when I spend an hour and a half with every patient, I'm a little bit obsessive compulsive about it. Nothing else in my life, just this one area. And but I want to look under every stone. A colleague of mine said, who wrote the book on functional medicine, said, here's a patient comes in, they trust you, they want help, and so which thing that could be causing them to be sick are you not willing to look for? You see the logic of it? What am I willing to forego? They're sick, and I have these things that I know could be making them, but I'm not willing to look for that test. I'm not willing to do that test. I'll just kind of like skim over that. I don't skim over anything. See, I'm an extremist in the functional medicine area. So I want to know right away why they're sick, and by golly, I nail it. Now, whether or not they can take 30 supplements a day is another matter. So we support people in the food supplements they have to take and so forth. So anyway, stress is the number one. Now this is a new model. This is a model in motion. There's 2 parts to our nervous system, the fight, flight, sympathetic, and the parasympathetic rest, digest. My job is to get the sympathetic stress back down, take away the allergies, take away the toxins, get all these stressors back down to help a person come into parasympathetic rest, digest. That's where the mind body wants to be. That's where you go when you sleep. And you build up all your neurotransmitters ready for another stressful day. See, that's the parasympathetic. So we're living in too much fight, flight, and we're burning out. Burnout is a legitimate, all these medical problems are caused by fight, flight, stress, but the fight, flight, stress is not just a psychological, it's not just the events in life, it's primarily biophysical. So the only diagnosis I use for depression is depression secondary to a physiological condition. That's the only one I use for a mood disorder, because there is no such thing as a mood disorder that's not caused by well-defined physiological causes that can be defined and corrected. See? So, all right, I'll get to the end here. So, you've heard of cortisol. Cortisol is one of the stress hormones, right? And so we test that. All right, so wrap it up here. Wrap it up. So I need to go all the way back to the beginning. Let's start at the very beginning. Okay, so we talked about this, which is still a very good model. There is a way for any chronic neurological psychiatric disorder to heal the brain. It's straightforward, it's methodical, we simply have to do the work. to find the causal factors and get to them and correct them. It's as simple as that. Questions and answers?
Yeah, we can do a few minutes of Q&A if anybody has some questions.
Give me a napkin, a towel for it. Yeah. Yes.
Would you comment with this slide up here?
Okay.
Comment a little bit on the leading prescription medications, and the one that you're interested in is statin, and its consequences. You know, 1 to 7 up there, and there may be some other leading
Sure.
pharmaceuticals that
Sure.
you could comment on.
So everybody thinks you have to have, the lower the cholesterol, the better, right? Well, it turns out that cholesterol fits between the tails of the phospholipids that, and hold your cell membranes together. So cholesterol under 130 is far more dangerous than a cholesterol over 250. Far more dangerous. And you're asking for Alzheimer's. And I see people come in with a cholesterol of 90.
What?
I see people coming in with a cholesterol of 90, which is like, you know, and the family doctors there, whoa, you know, and very, very dangerous. Cholesterol is the precursor for testosterone, progesterone, estrogens, the steroid hormones, and it's the precursor for cortisol, one of the stress hormones. So when cholesterol levels go down, you can't make progesterone and all these very important stress hormones, and you know, testosterone gets a rap as a sex hormone, but it's really an antidepressant. Okay. CoQ10 is blocked by statins, and the form CoQ10, which you probably heard, ubiquinol, right, is very, very important for aerobic metabolism, respiration. The brain's 2 to 3% of the body's weight, consuming 20 to 30% of the body's oxygen. And CoQ10 is very needed in that process of making ATP. So statins are a disaster in our country, just an absolute disaster. And the evidence of their benefit, very shaky. If you want to lower your cholesterol, take some niacin. Go get some vitamin B3 and take enough of it, and you know, it'll lower your cholesterol a good 30 points.
But is there really any reason you need to do that?
Maybe not. I don't know. It depends on the personalized uniqueness of the individual. If everybody in the family had cholesterols of 500 and everybody died by the time they're 50, yeah, then you know, you have to go after it. The questions? Yes?
By detoxifying the brain, do you also detoxify the body, or is it?
No. The brain. You've seen the science fiction movies where the brain sits in a beaker with some wires coming from it. We only work from the neck up. We don't worry about the. No, I'm just kidding. Okay. Yeah. Our cultural split between mind and body is, of course, a delusion. There is so many connectivities that we like the gut and the brain, for instance. There's so many connective areas, so we don't ever, you know, think in those terms anymore. So. Sure. Sure. Well, it's all the 7 R's. So we've got to repair the areas where the dopamine is synthesized the best we can. Yeah. Well, we have a few where we scratch our head. We don't know why. We assume they have Lyme or something, destroying the substantia nigra, the places where dopamine comes from. Maybe, I don't know. But generally speaking, we do very well with it, and it's applying this whole process. We want to regenerate the tiny amount of the brain that makes the dopamine, as many that we want to stop the degeneration of it. Heavy metals figure big in that. Aluminum is another one that's very big. And Fiji water and the volcanic waters remove aluminum. I encourage everybody who doesn't want to go gaga here to drink some Fiji water. But you apply it integratively and personalized to the individual to get it. And then, yeah, the neurotransmitters, we can do pretty good with it with an herb called Mucuna Pruriens, which is 60% L-Dopa. So we have an herb, but as a physician, I can prescribe it, and we try to taper the medication as much as we can, and then help the person absorb tyrosine so that they can make their own L-Dopa and make their own dopamine. So B vitamins are big, antioxidants huge for this. Glutathione, if you want to see amazing videos on this online, look up Dr. Perlmutter, P-E-R-L, he has a book over here, I just noticed, P-E-R-L-M-U-T-T-E-R. He put Dr. Perlmutter and Parkinson's. And he'll show you before and after an IV with glutathione, which is the body's most powerful antioxidant. So a person will be barely walking, they'll get an IV and then they're just walking around and looking good. And you couldn't do that in some states, but you can put videos like that up in Florida. You can get away with it, because then so we see that kind of thing. And then we see the patient, we give them glutathione and they don't get well. So we got to look deeper, got to find out what are we missing. Yeah, I think we have to get going. I'm sorry, but I'll sit around for a little while. Maybe we can talk some later.
Yeah, he's got some cards.
I have some cards here and some brochures and things. Okay. Well, thank you.